Hello everybody, my name is Dr. Chinmay Erram. I am the head of medical services here at Manipal Hospitals, Baner. Today we have a very renowned neurosurgeon, Dr. Jaydev Panchwagh, who has more than 25 years of experience in the neurosurgery field. He is very well known for treating some of the very complex brain and spine related problems. So welcome Dr. Panchwagh.
Thank you.
Sir, let's start with, we want to know what are your areas of interest within neurosurgery. Neurosurgery, though it is a very niche field, but it is a very vast field. So what are your areas of interest?
So neurosurgery, as you know, deals with brain problems and spine problems through surgery.
Right.
So we also call this branch as brain surgery and spine surgery together.
Correct.
Okay. Now, in neurosurgery, as you said, there are multiple areas, and I'm focused with my entire team for the last 20 years on 3 or 4 specific areas.
Yes.
The most important area that we are focused on is complex brain tumors and spinal tumors.
Okay.
The second topic that we are focused on very intensely is microvascular decompression surgeries.
Correct.
And these surgeries, as you know, deal with different problems like trigeminal neuralgia, hemifacial spasms, glossopharyngeal neuralgia, etc.
Yes.
The third important thing that we are focused on is endoscopic brain and spine surgeries. In Pune, the first endoscopic brain surgery we did long back in 2001, when we performed the first ever endoscopic third ventriculostomy in Pune. So after that, endoscopy has expanded. We use endoscopes deep inside the brain for various surgeries, and it has been a really long journey till now.
Yes. So I think today we'll talk more on the MVD, or what we call it as microvascular decompression, and specifically what we want to focus today is the hemifacial spasms. It's a very new, upcoming and very niche subject that we want to touch upon today. So can you tell us a little bit more on what are these hemifacial spasms?
So hemifacial spasms are spasms which come on one side of the face.
Okay.
Hemi means half.
Right.
So the spasms which come on one side, for example, a person who has spasms on the right side will appear like something like this. You see, my eye is spasming and my cheek is spasming while I'm speaking to you.
Right.
So half of the face goes in contractions repeatedly.
Correct.
Now these are involuntary. I mean, the person cannot control it.
Okay.
This disorder usually starts with eye blinking on one side, something like this, which actually many people experience now and then.
Yes.
But that is different. Now in hemifacial spasm, the eye blinking is only on one side, and especially the lower eyelid.
Right.
They feel the lower eyelid continuously moving from time to time.
Okay.
And initially they don't understand what is happening, and over the period of time this gets converted into frank cheek contractions like this. I'm just showing you because we don't have a patient here.
True.
So these are called hemifacial spasms.
Okay.
And in neurology there are many involuntary movement disorders, and very few are treatable.
Right.
So hemifacial spasm is one of them.
Oh, okay. And what is the cause? I mean, why does these contractions happen? Is it more like a twitching that happens?
So people call it twitching,
Right.
but they are spasms. Spasms are repetitive kind of contractions which happen on one side.
Right.
And they happen because of mainly the main reason or commonest reason for hemifacial spasms is what is called as neurovascular conflicts. So what is neurovascular conflict? In neurovascular conflict, the nerve, when it comes out of the brain, that is a place near the brainstem, and that is called as root entry zone.
Right.
That means where the nerve is entering or exiting, whatever you want to call it,
Correct.
just inside the brainstem.
Okay.
And that area in some people is malformed.
Okay.
It is not formed properly.
Right.
The insulation that is formed around the nerve fibers is not proper.
Right.
So if in such people there is a blood vessel which comes into contact with this region and starts pulsating against this, then because of years of this continuous hammering, this nerve undergoes further damage in the form of demyelination.
Okay.
And then there is a complex cascade that happens and the spasms start.
Right.
As I said, with the eye commonly,
Right.
very rarely it can start with the angle of the mouth, but commonly with the eye, and then it goes on progressively increasing.
Right. So along with this spasm, is there any pain associated with it?
No, in hemifacial spasm there is no pain,
Okay.
but some people get tinnitus with these spasms because the facial nerve and the nerve of hearing, they travel together in one bundle.
Right.
So many people say that when they are having spasms, they get ringing in the ear,
Okay.
but not all.
Okay. All right. So I was going to get to that because
Yeah.
tinnitus is, I mean, our audience might not understand tinnitus. So basically, tinnitus is ringing of a bell in your ear.
Yeah, the
And
sound
it's
that
on the
comes
one-
here, one side, and especially in these people, it happens during the spasms.
Okay.
Some people also tell us that during the spasms, they cannot hear properly from one side.
Right. Okay.
But these are the accompanying symptoms which we see sometimes.
Right. Any other compression in that area can lead to.
Yes. Another reason for hemifacial spasm is the tumor.
Okay.
Tumors, especially which are irritating tumors, especially the type which we call as epidermoid. And these tumors cause inflammation of the nerve sheath, and that tends to cause the nerve irritation and excitatory signals,
Right.
which gets translated into spasms.
Okay.
So this is one of the reasons, but it is rare. The commonest reason is a blood vessel in contact with the nerve.
I think the most common nerve that supplies to this part of the face is the facial nerve. So
Yeah,
we
the
have heard
motor
about
nerve.
Bell's palsy, and so how is it related? Is it related or it's completely different?
No, it is different. See, people sometimes make a mistake between these two.
Okay.
Bell's palsy is exactly opposite of spasms. In Bell's palsy, there is complete paralysis
Right.
of one side of the face.
Correct.
The face doesn't move.
Right.
In hemifacial spasm, there is overactivity.
Understood.
So exactly opposite.
Correct.
In Bell's palsy, one side of the face doesn't move; it is paralyzed. And on the other hand, in hemifacial spasm, there is overactivity.
Okay. Got it. And then, what is the treatment modality for such cases? Like most common.
So hemifacial spasms can be cured only with one method. There is no other method in the world
Okay.
that can cure these without causing additional problems, and that method is what is called as MVD surgery.
Okay.
That is microvascular decompression surgery,
Right.
and we do it with the help of microscope and endoscope.
Okay.
It is a niche surgery. It is technologically advanced, and it needs a lot of years of experience to know which blood vessel actually is causing the spasms.
Right.
So I think it is part of the neurosurgery which I would call a very, very niche corner, because it is not a mainstream surgery,
Okay.
but it is extremely effective if it is done properly.
Right.
And both these terms are very important,
Right.
because not only MVD is effective, it has ability to change somebody's life
Exactly.
for good.
Exactly. True. And before we get into the treatment part, what is the commonest modality of diagnosis?
See, when we see a patient with hemifacial spasms,
Right.
the first thing that we do is the MRI, but the MRI is also very specific.
Okay.
It has got different sequences which we need to order.
Right.
A normal brain MRI may not show the reason.
Right.
We need to study the part of the facial nerve which is entering the brain.
Correct.
As I said, it is called
Yes.
as root entry zone from different angles. And there are various methods and sequences to do it. And there we see the evidence of blood vessel which is pressing against the nerve.
Correct.
Or we see whether there is any other reason.
Right.
Very rarely there are causes which are medical causes of hemifacial spasm,
Okay.
which cannot be treated with surgery, but they are extremely rare.
Okay.
I would say out of 100 patients we see, less than 1% have these medical causes like demyelination or something like that.
Right.
So that also is seen well on MRI, provided the MRI is done on a good quality 3 Tesla machine.
Okay.
And done with done with the radiologist who knows about this disorder.
Correct. So it's more of a teamwork rather than...
Yeah, diagnosis is a teamwork. It's a clinical diagnosis, and it is corroborated with specific radiological tests.
Okay.
Because some people do not know what it is, and they are taking some temporary measures like injections of botulinum toxin, which is also called as Botox. It is a very temporary answer, and it doesn't treat the basic reason.
Correct.
In fact, while you are masking it on the surface, the compression of the blood vessel with time is going on increasing.
Right.
So that is another thing which I will elaborate on afterwards.
Sure. So when we are talking about the choice of treatment, you said that MVD is the only solution.
Is the only curative solution. That permanent cure is possible only with MVD, and this we say with about 20 years of experience.
Exactly. So if a person does come with symptoms of spasm, twitching, what is the first line of treatment that you offer? I mean, based on how much uncomfortable he is with the spasms.
The first line is actually for curing the problem. The first line is the surgery.
The surgery, right?
Because any chemical that is injected on the face, it is derived from a toxin from a bacteria.
Correct.
So it is not a very benevolent kind of a thing. When you inject it, over the period of time, it can cause its own problems.
Right.
It paralyzes the muscles temporarily, but also kills some of the units of myoneural junction permanently, some small portion. And over the period of time, weakness develops in the face.
Yes.
Also, with time, the body forms antibodies against botulinum toxin.
Okay.
And the antibodies then start destroying it. You need more higher and higher dose. So it's a cycle.
Right.
So I think for a disorder which can be cured with surgery, which can be cured by removing the basic cause.
Right.
Our team philosophically doesn't think that anything else should be done.
Okay.
The basic cause should be removed and the person cured.
Okay.
So when we see hemifacial spasms, first we counsel the patient. Many times patients don't know much about the problem, and then we need to counsel them, we need to tell them why it is happening and how surgery has the potential to cure it completely.
Correct.
And of course they ask about our experience, because the results of this surgery particularly depends on the years of experience of the team.
Yes, true.
Because it is sort of functional surgery.
True.
And then of course we tell them that we are emotionally, very much focused on treating patients of this disorder.
Correct.
And during last 20 years, we have repeatedly performed a lot of surgeries.
So how exactly is this surgery done?
So the surgery is done from this part. There is a small incision here.
Okay.
And we use endoscope which goes deep inside the brain.
Okay.
And also the top quality microscopes are now available. So we use these modalities. We sometimes use neurological monitoring during surgery. So there are various advanced techniques which are used.
Okay.
And what we do under magnification is we separate the root entry zone of the facial nerve from the blood vessel. And then we separate the blood vessel and we keep it separated with the help of Teflon.
Okay.
And then use glue, which is a biological glue, to stick that Teflon to the blood vessel so it doesn't slip. Sometimes when the blood vessel can be mobilized significantly, we use what is called as a sling technique, wherein we use a Teflon sling to lift up the blood vessel from the nerve and attach it somewhere else so that it doesn't fall on the nerve. So there are various techniques which are used. Depending on a particular case, we need to decide the technique which is required in that case. For example, some cases are difficult in the sense that there are blood vessels which are passing in between the nerves, that is the facial nerve and the nerve of hearing, and the blood vessels are stuck to the nerve. So it requires very careful dissection, and in such cases, of course, mobilization beyond the limit is hazardous. So we use some other techniques like interposition grafts and everything. So what we want to achieve is cessation of continuous hammering of the blood vessel on the nerve.
Right.
So this is what we want to achieve in the end.
So, and in the past 20 years, how many such procedures have you performed?
MVD cases?
In MVD.
So MVD surgeries are done for various reasons.
Yes.
For trigeminal neuralgia, hemifacial spasms or glossopharyngeal neuralgia, or sometimes tinnitus,
Right.
or sometimes we use it for resistant and repeated attacks of syncope, rarely. So for hemifacial spasms, we have performed till date about 770 plus surgeries.
That's a lot.
Which is, over the period of last 21 years.
Right.
And we have documentation of each and every case. We have patients' interviews and videos and everything preserved with us. I think it is easily one of the largest number of the surgeries.
Absolutely.
What happens with this long experience is that you see different types of operations.
Correct.
And as you accumulate the experience, you know which type of compression is to be treated by which modality.
Correct.
You know what exactly should be done. And sometimes there are more than one blood vessels seen in that area.
Right.
So with experience, you know which blood vessel is actually the cause of spasms.
Right. Makes sense.
So that is what actually makes a difference with experience.
Right.
And that of course over the period of time improves your results.
Correct.
And reduces the chances of complications.
Correct. So I was going to get to that. Performing almost 770 plus surgeries. How many patients do really get relief? Like what is
so in our
success
experience, the permanent cure is achieved by 99%.
Oh, okay.
I would say 99% plus actually.
Right.
And in about 0.5% to 1% people, the spasms do not disappear completely for various reasons. There are medical reasons for that.
Okay.
But 99% I think is definitely world-class result.
Absolutely.
And we have been able to achieve because the whole team
Correct.
is geared up for treating such patients
Right.
with empathy and with with lot of emotional energy invested in treating these patients.
Right. And you have treated patients around the globe.
Yes.
I believe. Patients who have come from US, Canada, you name the country and you have had patients. Why do you feel that they come to you? What do you feel?
So in between we did the audit of our cases.
Right.
And we realized, and we have published that also. So we realized that we have operated patients from almost all the states in India.
Okay.
Coming from all the metros, also coming from Delhi, Bangalore, Chennai, all the metros.
Yes.
And all other places also.
Right.
And I was thrilled when I got a patient coming from China border, and who could diagnose herself.
Right.
Because of the educational material that we circulate.
Yes.
About the problems she was having, and all the way they came here, and we were very happy to operate on her and provide the necessary relief.
Yes.
From the difficult spasms. So we have treated patients from almost all the states.
Right.
And from many countries, more than 14 countries, including the developed countries.
Right.
Because this subject is such that it is very niche.
True.
And unless some team is really focused on this, that team cannot really generate that much experience, because you don't get so many patients locally. Or
Correct.
For example, if I decide only to operate patients coming from Pune,
Correct.
that is the geographical area, I would be hardly operating 1 or 2 patients every year.
True.
Maybe 3 or 4.
Correct.
Now we perform about 4 or 5 MVDs every week for various reasons, out of which 2 are for hemifacial spasms every week. Now this number is achievable because we have taken up this surgery as a mission,
True.
because we want to help people with this disorder, and the entire team is emotionally involved in curing. We are our emotional energy is invested in treating these patients, educating these patients, providing them with some other supports.
Yes.
That's why this is number of such large experience is possible.
True.
And that is why such centers are very rare in the world.
Exactly.
And that's why people travel all the way to Pune in India for the treatment.
Right. And a specific center has been developed just for
Yes.
MVD surgeries.
Yes, and this center, we don't only perform surgeries, we also have 4 counselors with us who talk to these patients. There are people who have already been operated and who have expressed desire that they want to help any newly diagnosed patients, so they are willing to speak to these patients.
Correct.
To give them confidence, to give them the support. We listen to their story with empathy. There are people, with those specific skill sets.
Correct.
Who can give that kind of support, psychological support.
Yes.
And then, of course, during surgery, we are absolutely focused on using the best technology,
True.
the best dexterity, the best of the surgical prowess that we can possess.
Yes.
Focusing at progressive surgical excellence as a team, not
True.
only as a surgeon,
Right.
but as a team. And all these things together help us to form such a center.
True. And I think these are the factors that you just mentioned,
Yes.
which determine the success of the center.
Yes.
Anything else that you feel that you're adding such centers are very few in the country or probably in the world, and one of the centers is yours.
Yeah.
Any X factor that you want to mention that is really helping you out with the success of the patient?
Yeah. See, I think this question was recently asked in one of the interviews, and actually, then we started thinking, and I realized that what is so distinct in our center, the number of patients, that is experience that has got accumulated, that has taught us a lot of things.
True.
And MVD surgery is done only for hemifacial spasms in 770 plus patients now. With the entire documentation with us,
Right.
we can go back to all the cases, review the videos, we can learn again and again from them. So it is a very unique thing that we have accumulated.
True.
So that is one of the reasons. Second important reason, and I would say that it is the most important reason, is the emotional factor.
Yes.
Any patient coming to us is not just a number, it is an individual who is
Yes.
suffering. Because when one has hemifacial spasms, that person faces social anxiety.
Yes.
When he or she goes in the society, it is very difficult to face people.
True.
They have marital problems.
Yes.
They have problems in their job. Young people cannot get jobs.
Yes.
They are ridiculed.
True.
So it is a horrible disorder actually.
Yes.
So the entire team at our center, I insist that they have to know about this disorder.
Yes.
They have to really empathize with those patients.
Right.
They have to treat them kindly.
True.
They have to listen to their stories, and they have to be focused on giving them the chance of cure.
Yes.
This is a factor, I think, that separates excellence, real excellence. It is not only the surgical ability.
Correct.
It is the ability to connect to the patient's story.
True.
Having this inner voice telling you that you need to help this patient and cure this patient with your hands and with your surgery. It's something which sets our center apart, and this is a very genuine assessment that whenever I see our counselors speaking with the patients, I am very happy that they speak from their heart.
Right.
And even after surgery, the care that is taken
Yes.
is, I think, unique in the world.
I've seen that, apart from doing the surgeries, treating the patients, you are very much involved in propagating this information.
That
You
is
have your
patient
own-
education.
You have your own social media channels and networks, and you are very active on there. You are, very proactively giving all the information, educating everybody, so maximum people can know about there is a success for
Possibility
such
of
conditions.
success.
Possibility of success for such conditions.
And one of the reasons, is that hemifacial spasm, like trigeminal neuralgia, unnecessarily it has become a subject which is wrapped up in a lot of opinions.
Okay.
Actually, the opinions are expressed many a times by people who actually are not treating these patients this frequently.
True.
And
True.
that is very sad, but only way to deal with this is to educate the public.
Correct.
For example, the diagnosis gets delayed. You will be surprised that one of the leading ophthalmologists on whom I operated for hemifacial spasms himself did not know that he was suffering from hemifacial spasms. So this is the type of awareness we have even in medical community.
Yes.
And the second problem is with medical industry, and there are so many factors which cannot be directly discussed on such forums. But people are wise to understand what I am hinting at. See, one of the problems that I see frequently is that people are told that this surgery is extremely risky. And they don't even know our results. They have not spoken with us, but they have formed their own opinion. There is no doubt that any surgery can have a risk.
Yes.
Any surgery.
Yes.
I tell people that even there have been accidents in simple surgeries like hernia surgery.
True.
Or surgeries like cesarean section.
True.
So to say that any surgery is without risk will be absolutely wrong.
Yeah.
But to live your life with this kind of spasm, isn't that a risk?
It is.
So risk is not only in surgery. So you have to balance a risk of not operating and getting cured versus risk of suffering from this disorder.
Correct. Agreed.
And finally, the decision is patient's decision.
Yeah.
We never try to convince beyond a limit. We tell them that it has a potential and these are our results, but beyond a limit, we let the patients take the decision. The problem with injecting with botulinum toxin, as I told you, is that it is a temporary solution.
Yes.
It causes temporary paralysis of the face.
Right.
And during these injection time, repeated injections, the basic cause of pressure on the nerve
Is
that goes
not
on
resolved.
that remains unresolved. That goes on increasing.
Correct. True.
So when the Botox wears off, what happens is that suddenly there is increase in the intensity.
Right.
It's a progressive disorder.
Yes.
So it is very important to create public educational material for this reason.
And it's equally important, as you said, within the medical fraternity as well. They should be aware that such a modality is available for the patients.
Correct.
Because usually the patients will go to a doctor. And so my next question is, how many second, third, fourth opinions do you get? Usually the patients, do they come directly to you, or do they, take a first opinion, second opinion, and then they come?
Yeah, both. Some of the patients now, because of our educational materials, they understand what are hemifacial spasms. See, you have to realize that God has given this common sense to everyone.
Yes.
So people have that ability to, diagnose themselves and then come to you.
Okay.
So that happens. There are certain references also. There are many neurologists who know that we are doing this cutting edge work. So we get references also. So it's a combination.
And I mean, you have treated so many people. Any notable figures that we know of that you would want to share? That
I mean, what I want to say is that we have treated people from all walks of life.
Yes.
I cannot take names, but we have operated an international dancer. We have operated a international model coming from another country.
Right.
We have operated on a singer who is very well known in North America.
Okay.
We have operated on, as I said, a model. I said the doctors, many doctors. We have operated on police officers. Okay. You can imagine a police officers trying to arrest someone with a spasm. So what respect that person will get? These are very funny stories. They appear funny, but for these patients, it is very. They are very serious. We have operated on politicians.
Okay.
We have operated on politicians because for them, hemifacial spasm is a nail in their career. So of course, individual names we cannot take because of privacy of the patients. But yes, I mean, we have operated on many known people, many known personalities. Some of the stories that are I have told repeatedly, that one patient, how he was beaten up in Mulund in Mumbai. He was standing on a bus stop, and the lady next to him thought that he's winking, and he was beaten up. One secretary was thrown out of job because some customer complained to the authorities that when we come to this office, your receptionist is winking at us. These are actually true things that happen with hemifacial spasms.
Yes.
And marriages have got broken.
Yes.
So these people should know that there exists hope.
Correct.
We can cure these patients.
Correct.
But final decision is, of course, with the patients.
So this can happen to anybody.
This can happen to anybody.
It's not related to socioeconomics.
Commonest age is between 40 to 70.
Okay.
But we have operated a patient as young as 18 years of age and as old as 78. Now this 78-year-old lady, I should tell you the story. She came from Canada to us, and that was the first patient. I said, Madam, you rethink about your decisions. She said, no, I have studied this, I have studied you, I have studied your work, and I want to get operated because I want to be socially active.
Right.
And we operated on her, and she was cured, of course.
Well, thank you so much, Dr. Panchwagh. I think we covered the topic pretty much in detail.
I hope
that you would want to add.
No. I hope this, this type of talk helps us to take this subject to general population.
Yes, true.
And I will show a short clips here.
Okay.
With hemifacial spasms. Why? Because I want people to see these cases so that they can self-diagnose.
Right.
So here is one person with hemifacial spasms. As you can see, very severe spasms affecting the face and repeated contractions. Now this is a case with very, very mild spasms, but very disabling in social circumstances. So these are the examples of hemifacial spasms.
Yes.
And people should know about these spasms, their cause, their treatment, and the fact that we have the ability to cure these patients, provided they make an effort to come to us and seek help.
The whole idea is to make them aware, that such a modalities exist, and we can.
The
whole is available.
Sure.
And they should not lose hope. And
I think public information is the most important thing.
Yes.
When people make choice about their own lives,
yes,
it is the most important thing.
Right.
Rather than anybody referring or anybody suggesting.
Yes.
They should be given the medical knowledge, they should be educated,
right,
and they should take decisions themselves,
yes,
rather than depending on anyone else.
Agreed. Well, thank you so much, sir. You took out time today and we spoke about hemifacial spasm, and it's just one of the topics that we have covered. In a lot of things to discuss with you. But anything that you want to conclude with, you want to add?
Yes, I think I would, in the end, I would like to request everyone to refer to the various resources that we have made available.
Yes.
For studying. You can visit a YouTube channel which is by my name, that.
Yes.
It's called as Dr. Jaydev Panchwagh. You can go on that, click on the playlist of hemifacial spasms.
Okay.
There are 100 videos about hemifacial spasms.
Right.
So anyone who is suffering from hemifacial spasm, please go to that link, see those videos. There is an international helpline that we have created.
Okay.
So go to that helpline. If you want, you can contact us, and we can certainly help you. Also, for people who have got cured by surgery, I would like to request that please take more and more part in educating newly diagnosed patients.
Right.
Because such work can only sustain if the previous patients, guide new patients.
True.
It is called as patient support kind of activity.
Yes.
And in the Western world, people do it very frequently,
Yes.
So we need to do it in our country. We have to start doing it. Now with internet, they can do it very well.
Very well.
So that is another request that
Okay.
I want to make.
Sure.
And should any of you have question, please post them. I will answer them myself.
Right.
You can forward it to us or
Absolutely.
our counselors.
Sure.
We can certainly answer to your questions. And again, please do visit the YouTube channel where there are around 100 videos.
Sure. Sure.
They will be very educational.
I would urge all the viewers to go on the channel. You know, Sir has created a huge repository on not just hemifacial spasms but various other, neurosurgical disorders that he is treating through his center, and now he is associated with Manipal Hospitals. So we thank you for that.
Thank you.
And we will cover more topics in the future related to, probably trigeminal neuralgia, the
The glossopharyngeal
glossopharyngeal
neuralgia.
neuralgia. So we will be talking on those subjects as well with Dr. Panchwagh. But till then, thank you so much for watching.